Member for Powell River, Sunshine Coast.
Thank you, Madam Speaker. This government's decided to close 2 long-term care facilities on the Sunshine Coast, only to replace them with 1 for-profit facility with a small increase in spaces. This is a bad decision for seniors affected. It's bad for the hundreds of employees who will be laid off or rehired at lower wages, and it's bad for our communities. The Sunshine Coast has been saying loudly and clearly seniors, elders, and their caregivers deserve better. Honourable Speaker, they don't want to see profits going to private companies because that's money that is not spent on care. Will the minister please explain to the family members and caregivers why seniors are paying the price for this government's failure?
Madam Premier.
Thanks, Madam Speaker. First, let me acknowledge the caregivers in Powell River Sunshine Coast and around the province who do so. I mean, in long-term care in particular, the relationship that caregivers create with the patients is really admirable, and in many cases, I mean, it's almost unbelievable the amount of energy and love that people bring to that job. So, you know, on behalf of everybody in the House, I'd like to say thank you to them, and in this case, in this case, a new facility that will be state-of-the-art with an additional over and above 20 new beds that will be added, which will make it even easier to be able to look after people who are elderly or need that long-term care in that part of the province. But that is in addition to the $101 million for the new Centre for Mental Health and Addiction at Riverview, the $417 million for a new patient care tower at Royal Linland Hospital, which the NDP said they wouldn't build, the $325 million in Penticton, which again the NDP said that they wouldn't build, $606 million in Comox Valley and Campbell River hospitals, the money that's going into over $1 billion that will be going into the new state-of-the-art hospital at St. Paul's, which again the NDP said they would not build. The way to make sure that we are looking after patients in British Columbia is through items in this budget like $4.1 billion into the healthcare system. It's investments in making sure that we are building the infrastructure. After a decade in the 1990s when not a single hospital was built, this government is making sure that we are looking after patients, investing in infrastructure, making sure British Columbians have the health care that they need. And I know the iron workers who are here today will appreciate this, making sure we are putting British Columbians to work when they build them.